everybody. I'm Brad Robling. It's my pleasure to be able to host this panel today. I co-lead Lilly's corporate venture group here in Indianapolis. But more importantly to me, I want to turn it over to introduce my guests, who are also friends of myself personally and Lilly. We've known these teams for a long time, so I'm excited to have them as panelists, and I hope they talk more about their backgrounds than me. So I'm going to talk it over to Kendra and to talk a little bit about her background, herself, and then we'll turn it over to the team here and then come back to the companies, if that's okay. Kendra,
Sounds
please.
great. Okay, awesome. Hi, I'm Kendra Tatarski. I work at Touchdown Ventures. We partner with corporations to set up and help manage their venture funds. We run about 20 different corporations across 5 verticals, so food and ag, industrial, built world, IT media, and healthcare, which is where I sit. My background is spread over innovation, research, and investing my whole career, initially in retail and consumer as an equity research analyst. Then I moved to early stage investing, spent about 5 years at Nielsen in a role similar to Brad's, and have been at Touchdown for about 6 years. So it's great to be here. Thank you.
Thank you.
Hey everyone, my name is Annie Vemu. I am an investor at Longwood Fund, and Longwood Fund is a single office that's based in Boston, Massachusetts. We primarily focus on therapeutics, and we do 2 things. One is invest in early stage ventures, so seed all the way through Series C. And in addition to that, we also start companies, and I work on both verticals. And prior to that, I was at Flagship Pioneering, doing venture creation there, and I'm a scientist by training. I trained at the NIH in biochemistry and biophysics. Good to be here.
And good to be here, everybody. My name is Max Farina. I'm a principal at 5AM Ventures, based in San Francisco. I'm a physician by training. I went to medical school at Yale, and then after graduating, spent time at Goldman Sachs in New York in their investment banking group covering biotech and pharma companies. And now I've been at 5AM Ventures for 3.5 years. Looking forward to the conversation today.
Great, thanks everybody. And just for a little bit of education, maybe for the audience, the difference between corporate venture and regular venture, does anyone dare take a stab at what the difference is? I'll ask the hard question. Maybe, Kendra, go to you since you've been in both. So
Okay.
we'll
Okay, great. Yeah, so the difference is where's the capital coming from? So financial investing is coming from endowments, family offices, pension funds, a variety of different financial these guys can answer that question better than I can. And corporate venture is coming from corporations. And the way Touchdown structures it is every corporation has their own fund with their own governance, and we provide all of the venture capital expertise like a financial VC would, but the capital is just coming from the corporation with a strategic mandate in addition to financial.
Maybe to add to that, in terms of the type of investing that we do, we don't quite have a mandate in terms of specific therapeutic areas to invest in. It's oftentimes dictated by what we think about our portfolio construction to look like. And in addition to that, we also start companies ourselves. So we go out, we find really cool ideas in academia or in pharma that we want to spin out, and then start companies that way as well. So that's also a slight distinction.
Great. Max, anything else?
No, I think the panel covered it well. Yeah.
Well, I'll add one more thing, because I agree with everybody on the panel. I think also that one of the fundamental differences too, and I can say this because I'm in a corporate venture, is that there's a strategic angle that comes into our investing, right? The reason why we have venture capital money is actually to help with our pipeline. Some corporates have a dual mandate. They have a financial mandate, like our VC friends to my left, and they also have a strategic mandate. At Lilly, we have a strategic mandate. In other words, we're here to find great new technologies and companies to bring them inside Lilly. Yes, I tell my CFO our hope is to make money on those. Our friends to the left for sure have to make money on those to survive and thrive. Hopefully I do too, but we'll see. That's always in the rearview mirror. But anyway, so thank you for that. We got to do one fun thing before I kick this thing off. And I warned the panel that I would do this. So Touchdown Ventures, where did the name come from before we get into the meat of the discussion?
So 3 of our founders, our 3 founders are sports aficionados, very passionate about sports. And I think they figured Touchdown was a double entendre of, touching down a great investment, winning, and apparently all 3 of their wives said it's a terrible name, but it's lasted 10 years, and we love it. And I would say virtually every employee at Touchdown loves sports in some way, shape, or form. So it's kind of a fun nomiker to latch onto.
I love the name too. We have to go to Longwood.
Yeah, so Longwood's name comes from the Longwood Medical Center. So our co-founders used to live in the Longwood Medical Center, hence Longwood Fund.
Easy. Max, 5 a.m. Anybody have a guess on 5 a.m.?
It might be a surprise. Well, there's two stories.
Oh.
There's the story that I was told before I signed my offer letter, which is that we invest in early stage life science companies, and 5 a.m. is early, and so that's the sort of the origin. Of course, though, once I was within the company, I learned that there was a second meaning, and that's that we also start working pretty early in the morning. It's
At
not
5 a.m.
Not always at 5 a.m., but it's not never at 5 a.m.
That's great. At Lilly, we're super original. I use marketing branding. We're called Lilly Ventures, so there's no story behind that, okay? Just to be clear. Well, let's maybe pivot over to sort of the meat of the discussion, if you will. So we're all investors, so let's talk about the macro environment for a minute. So let's talk about the basic fuel for the fire, if you will, in venture investing, the availability of capital, either for companies or for fundraising for funds. Give me a perspective on that. I'm going to start in reverse for Max, because Kendra's next to me. But maybe give me a perspective on that. And for those of you who don't follow the venture capital world, in particular the biotech venture capital world, but the tech world would follow closely, we had some really, really good years, and the last 3 or 4 years have been a little tougher from either a fund capital formation side or even from a company's perspective. Maybe if you give me yours, Max, that'd be fantastic.
Yeah, I mean, I'm sure that, I know that there are a lot of founders and CEOs, operators in the audience, and I would guess that many of you can feel that this is a tougher funding environment for companies, certainly than in the 2019 to 2021 period, but even before that, it's hard. And if it gives you all any solace or relief, know that it's also hard for capital allocators as well to go out and raise new funds from our LPs. I think luckily for 5 a.m. we're not fundraising right now, but it's certainly something that has been challenging for our peer firms, and that I think is going to continue to be challenging for a couple of years. I will say that there is still record amounts of capital on the sidelines ready to be deployed into this space, and so the money is there. It doesn't mean that it's going to come easily, but I think we are feeling a little bit of a thawing of the winter that's been going on for the last few years, and we're seeing more and more funding rounds, more early funding rounds. Valuations is a different story, which I'm sure we'll come back to, but it does feel like there is starting to become more capital available for really breakthrough ideas.
That's great. Annie, do you have a perspective on the capital availability?
Yeah, maybe just kind of piggybacking off of what Max said. Somebody said this to me, and I'm going to borrow it, where it goes something like, the bigger the party, the bigger the hangover. And it feels like in 2020, it was kind of a mega party where there was capital that was being injected into life sciences from atypical investors, and then it felt like a really big party. And perhaps now what we're seeing is those atypical investors leaving. We have the specialists that are still investing. So things feel like they're taking longer. So I don't think it's impossible, but it definitely does feel like things are slowing down. And echoing what Max said, there are still deals that are being done, and it feels like good deals are getting done, but it just takes a little bit longer for that to happen.
Great.
Yeah.
Kendra, go ahead.
I mean, I would echo everything that's been said. I think to Max's point, there's about $300 billion of dry powder on the sidelines, so certainly enough capital to go to work. And the PitchBook data, and granted, we're not raising money the way these guys are, so the data is always a little bit misleading. But it looks like we're at the 2014 to 17 levels in terms of number of funds raised and capital raised. So it is, in our opinion, coming back some. We're seeing it on some of the valuations. I think the numbers don't tell the whole story in terms of valuations. Maybe Max, you were going to refer to this. It suggests there's a slight uptick in valuations. It's probably tied to AI, which I know we're going to talk about a bit more. But I think to Annie's point, the good deals are getting done. There's more time, which from a corporate venture perspective, we actually appreciate, because we do like to understand the strategic opportunity, and we're not just going to throw capital around. So I actually think it's good for the industry that we've had this breather, and I think we're going to still continue to see great companies getting funded.
Yeah, great. At Lilly, it's pretty simple. I have one shareholder. You made that earlier. And they've been fairly giving the last few years, so we hope that continues. So, well, great. Let's move over, because this is obviously related, sort of the risk-reward side of venture investing. Let's move over to maybe venture capital's risk appetite. And I think most people think about whether it's corporate or whether it's external venture is that it's always quite high. And I actually believe that's the case, but I think even within that, it changes over time. Maybe we can come in reverse order. Have you seen a change in the last 3 or 4 years in terms of the risk aperture?
Yeah, I mean, obviously our aperture is our lens is going to be more, corporate oriented. I think that there's always people that are further on the risk curve than others. I do think in a kind of heady market like 2020, like Annie referred to, you've got people that have FOMO and feel like they have to chase it. The disciplined investors typically kind of bide their time, wait for the valuations to come their way. They may selectively do that, but I think from the corporate standpoint, what we say to our partners is you should always be in market. The benefit of not being a financial LP is you don't have to be making investments, but you're constantly learning about what's happening. I'm sure you guys see this at Lilly, that every company you see, you're learning something, even if you're not investing. And we think that using corporate venture is a way to go further out on the risk curve. It's less risky than M&A. It can be less risky than partnerships sometimes, depending on how deep those partnerships are and how embedded you are. So it's a great way to kind of complement some of the other initiatives that you can put into play as a corporate.
Kendra, do you mind if I follow up with one question? You have a really unique lens at Touchdown. You see a lot of different things. Would you say corporate venture is up relative to 10 years ago in terms of the numbers of companies that use it as a tool? Or would you say it's flat or hasn't changed much? Where have you seen the last 10 years in terms of corporate venturing? Because obviously you have a lot of clients and you're touching a lot of different groups.
Yeah, I mean, it's interesting because the data will tell you that the average corporate venture fund shuts down after 4 years. That's because either there hasn't been a strategy put in place, changes in leaderships, not having clear KPIs and delivering against those KPIs. So I think it's one of the reasons Touchdown's been successful, and I don't mean this to be a Touchdown advertisement, but we've been around for 10 years, and we've grown from 5 funds when I joined 6 years ago to over 20 now, and I think it's because of the discipline and the expertise. I think you need to put a team in place, whether it's how Lilly did, where you hire people internally or you partner with somebody, if you're really going to drive that value, because it's hard, to your point. And I think that more and more corporations are leaning in. We get a lot of inbound, but you want to really approach it in the right way because they shut down just as fast as they start up, if not built the right way.
Right. And Annie, back to you maybe on the risk appetite, maybe from an external venture perspective in bio. Maybe you could give us your view on how that's changed more for maybe some of the same, or how it's different today versus a few years ago.
Yeah, I think that a few years ago versus now, it's definitely changed in that folks now, investors especially, are more interested in sort of program-centric view in terms of back then it was more platform, kind of dreamy in terms of where could you take this technology, but now it's more so what's your first program? Where is it in terms of development? Is it in the clinic? Because oftentimes getting clinical data is the value inflection point for any given company. So definitely the sort of pendulum has swung towards more kind of focused companies with specific programs and clinical stage data. But I think that being said, that kind of creates this unique gap, if you will, in terms of super early seed Series A companies, whereby now you can have all these sort of academics or other things that are earlier on that maybe you can find diamonds in the rough and make them into companies and start sort of grooming the next set of new companies, which is something that we also do at Longwood. So it's kind of a nice stack in terms of doing the later stage clinical stage companies as well as the earlier stage, sort of the dreamier ideas, if you will.
Annie, do you mind if I double click on that one too? So you talked about this analogy of the bad hangover. Maybe I'll stay away from that for political purposes, but I love it, by the way. I'm assuming that's correlated, right? There's some correlation between capital getting a little bit tighter and now companies more forced to take fewer risk or more focused risk or less risky bets. I just want to make sure the audience understands that. Or is it all the above?
Yeah, I think it's definitely related to that. But in addition to that, maybe there's also the added layer of investors also have their own portfolios to worry about.
Right.
Where there's also, maybe there's really early companies in their portfolio. So now they're trying to balance it with some later stage companies.
Excellent, excellent. Max, last but not least.
I mean, I totally agree with Annie's comments on the shift in sort of focus profile. But I think the other big bucket of risk where I've seen a meaningful shift is financing risk specifically, where it seems like, historically, if a Series A company in an interesting field went out and achieved their Series A objectives, chances were Series B investors were going to be there, they were going to care, and they were going to fund a Series B, usually at a step up. I think that assumption over the last couple of years has totally gone out the window, even for companies that are making fundamental progress. And so I think that's manifested in larger round sizes, trying to get companies further, more proof of concept, more data on a Series A round. And also just, I think it factors into syndicate construction as well. We're seeing broader syndicates. We call it a deep-pocketed syndicate, sort of a positive indicator of a Series A, so that if the company is doing really well and has a promising program or programs, but late-stage investors aren't there, the existing syndicate has to be able to really jump in and lean in and continue to fund the company themselves, which wasn't the typical playbook historically.
Yeah, and just to remind everybody on the table here, most of us play on the private side. That's not exclusive. There are some public components of what you guys do, but a lot of our references are to the private side. Yep. Super great answers. So Andy, I'm going to convert over now to one of our more fun topics for any entrepreneur or investor on the planet, valuations and round sizes. So I'm going back to you because you have this great analogy. Maybe just give us your perspective on sort of company valuations today versus 3 or 4 years ago, and sort of how big round sizes are. And for the people who aren't familiar with the nomenclature, round size is just how much money you're raising to essentially get from point A to point B. Let's start on the valuation side. That is usually an exciting topic for anyone in the investing world. So,
yeah, I guess on the valuation side, we've seen sort of a bimodal distribution on valuation. I would say there are deals that are maybe on the cheaper side that people are excited about, and sort of everybody's kind of flocking to those. And then you have the other ones that are expensive, but still people are excited about, because it's sort of like people have the mentality of you get what you pay for. If you're going to get awesome clinical data, people are still willing to shell out the money, if you will. So I think that we're kind of seeing both aspects of it, but perhaps what has changed is gone are the expectations of really expensive deals where there's perhaps the pipelines are still super early. Even interestingly enough, even with the moniker of being AI-based companies, there was a time when you had an AI component where the valuations were perhaps what folks were thought of as too high, but that doesn't exist anymore either, which is kind of an interesting data point as well.
Yeah, that's a precursor. I think we should have started out with AI first. That would have kept the audiences gripped from the first minute, but we'll get there eventually.
Look forward to it.
We'll look forward to it. So Max, maybe your perspective on valuations.
Yeah, I think we're seeing the same thing. I think that the data suggests that median valuations are down from a year ago, and certainly way down from 2-3 years ago. But I do think some of that ties into the round size comment that I mentioned earlier, where financings are getting a little bit larger, and it really comes down to the math. And I'd be curious about the corporate venture perspective, but many financial investors have ownership targets that they need to achieve in a specific round. And so if the investor's check size is the same and the round size is larger, the balance has to come from somewhere, and often that comes from pre-money to sort of make the math work in terms of the return that an early stage investor is expecting. So I think that dynamic is certainly at play as well.
Excellent. Kendra.
Yeah, Max, you raised a good point, because corporate venture funds don't typically, I don't know how Eli does it, but we don't have minimum ownership targets. We are more interested if there's a strategic overlap, whether it's kind of core or adjacent or maybe frontier, kind of looking around the corner. Oftentimes we can write a very small check to be part of a larger syndicate for a later stage round, particularly if there's some commercial value. We think we can bring a lot more than dollars to the table, and so oftentimes we'll be let into a hot round just because of the commercial value that we can bring alongside even a relatively small check. So we don't really think about the ownership stake itself. The other thing I think that we're not really seeing, and curious what you guys think about this, and Brad, if you guys are seeing this, is that there's still a lot of companies that are dealing with the hangover that Annie referenced that are not actually not clearly coming to market. They're not public rounds, they're insider notes. That was definitely true last year. We're seeing a little bit less of that this year, where people are like, all right, you know, we got to take our medicine and like really price these rounds. But I think we're going to see continuation of that through the end of this year and probably into early next year. I think the mantra at the end of last year that I heard was survive until 25, and so I think companies are doing that, and you know, I think that they're getting more efficient with their capital, which I think is really important. We pay a lot of attention to that, and you know, I think 25 is going to be a really interesting year.
Yeah, good. There's a lot of threads to fall through. Maybe Max, I'll just come to from a Lilly perspective. We're not targeting dollar size. For us, it's following the science and getting closer to the company. But yeah, that's not a big thing for us. But I think, you know, having the right dollar amount that is meaningful to the round and to our partners like you guys is super important. Wow, there's too many things, at least for us on the panel, to sort of dissect from there. Maybe I'll move away from evaluation for a second and then just talk about innovation writ large, because I think a lot of people think of either corporate or classic venture capital as investors for innovation. Right, at the end of the day, like these are bringing new technologies, new medicines, you name it, new anything to the table. Is there anything out there that you guys think have changed? Is that still the case? Is venture still taking risk in truly innovative things? So maybe I'll start with that, and we'll go. Kendra, you're up. You get the first one. I'll go in these different orders,
Okay,
right? So, have you seen a change in the innovation side and what's getting funded, or it really depends? I know you cover a lot of ground, so it's kind of a generic statement. But let's sit there for a second on the innovation side.
Yeah, I mean, I think, you know, because we run so many different funds, there's slightly different preferences by corporation. Some are, again, are further out in the risk curve. They've been doing it for longer. They're more comfortable with it. Others are newer to it, and they might say, okay, we're just going to do some things that are close to core, maybe just adjacent. But I think the more comfortable that corporations get with their investing, the more they're willing to take some, you know, outsized risks and fund really innovative things. I was talking to one of our partners a couple weeks ago, and I said, I really think that corporate venture capital is an opportunity to think about where healthcare is going to be in 10 or 15 years, not where it's going to be next year or in 5 years. And so I think that's the opportunity for corporate investors in particular, and I would assume for you guys as well. I mean, we're not betting on what's going to happen in 2026. We're betting on what's going to happen in 25. And there's so much happening in the healthcare space. It's a really exciting time to be investing, particularly on the less on the bio, because we don't do the bio side of it. We do more of the, as I was saying, picks and shovels, care delivery, things like that. And so how are we thinking about that within the healthcare system, and who's paying for it, and all of that is a really fascinating topic.
Yeah, I don't know if you and John Pavletic talk too much, but we have a strategy on our tech side called 2040, and he says it's for just exactly what you said, and I said, well, that's because you don't want to make any answers to any questions in the next 15 years. That's a whole different story, but I like that. I love the thought about having a long vision. Annie, to you on the innovation side, anything of interest coming to Longwood that you're seeing, change in appetite for that?
Yeah, I think that there's still a lot of really cool, innovative things that are coming to us on the therapeutic side. Like, just to rattle off some examples, like in the neuroscience space, there's all these novel targets that people are pushing forward in various, be it neurodegen or even in neuropsych diseases. So we're still seeing that science that's being pushed forward. And on the modality or the drug side, like the things that we saw that we didn't see maybe 10 years ago was radiopharma, for example. So there's still really interesting science that still is at the forefront.
Great. Max, anything to add?
Yeah, I mean, I think all of us in venture are optimists, and we have to be optimists. And so I think we want to believe in these big ideas. You know, the real innovations are going to make a big difference for patients. And so I think that'll always be kind of the bread and butter of venture investing. You know, I do think the one profile that is not really working so much today, even though it was a few years ago, is I think big platforms for the sake of platforms, where, you know, there's maybe some novel biological insight or you know, a big discovery platform, and the application isn't quite clear, but early investors, I think historically, were willing to underwrite it anyway, just sort of assuming that, you know, this is so broad that there's bound to be a valuable application somewhere. I think now investors are certainly still investing in platforms, but the concrete application has to be much more, I think, thought out earlier on than it did in the past. You know, we now need to be underwriting a specific use case that makes sense and addresses a real clinical unmet need instead of figuring it out later.
Excellent. Well, I think these have been great commentary on the macro. Let's move into the micro, or the entrepreneurs in the room. These topics so hopefully will be of interest to everybody, but let's talk about syndicate building. And again, we get so used to our terms. You're raising money, essentially, right? You're raising money, and the syndicate is of the investors that will be investing in your company. So Kendra, maybe we'll start with you in terms of syndicate building or fundraising in today's environment. Now, well, actually, you know what? I'm going to go to Max. I know that you cover too many different clients, so I'll go to Max first and make it tough on him. Maybe tips for success if you're an entrepreneur out there. I know you focus on biotechnology, but I think a lot of these tips and things follow any industry and any company.
Yeah, absolutely. I mean, I think there's the obvious advice, which is that if you've got multiple options, multiple term sheets or investors that you could work with, try and pick the investors that you like working with, because you're going to spend a lot of time with them, and it's going to be a long-term relationship, and so that's helpful. I think the less obvious piece is sort of always ask your syndicate members or prospective syndicate members how they plan to reserve capital, how they think about supporting the company long term. We hear a lot of stories where investors will come in with a really nice valuation number and take a large part of a round, and then when it's time to raise the next round, they're not really able to continue supporting the company, and that puts management and the rest of the existing investors in a really tough spot. And so I think to the extent that you can build a well-rounded syndicate and a broad syndicate that can credibly say, we can take this company to the next level ourselves, it just really helps those later stage negotiations sort of land more in favor of the company.
Yeah, great.
I guess in addition to what Max had said, having a diverse syndicate is always really nice, just in terms of the perspectives that come about, be it sort of the corporate VCs that come around the table, or sort of like the 5 a.m.s or the Longwoods. Just having a diverse set of folks around the table always sets the company up for success. And the other piece, more practically, is oftentimes we hear companies being like, hey, we wanted to talk to you once we sort of we're ready to raise. And we always come into the mindset when we speak with companies, it's never too early to talk to venture folks, for multiple reasons. One is that they get to start knowing what are the types of things that venture people like to invest in. And in addition to that, you sort of then can start shaping your story in a way in which it not only helps the company, but it also helps the venture people in terms of getting excited about the idea.
Yeah, it's such good points. I would echo Annie's point on talking to your investors or target investors early and often, particularly on the corporate side, because there is the commercial value, and hopefully we're also giving some value back in terms of feedback and what the corporations are saying, or different perspectives. I hadn't realized that a lot of financial VCs were not holding back reserves. We definitely advise our corporations to do that. It's a fatal flaw for some corporate funds that they don't do that, and it's been a bad reputation that we've been trying to correct for corporate venture capital, is that you've got to reserve. The other thing I would say is just having seen founders that have made this mistake in the past is do your references on the investors. Call their portfolio companies. How have they added value? Is this particular investor going to fill a gap that maybe you have? Maybe that they have a lot of operator partners and you don't have any other VCs on your cap table that have that. Wherever the gaps are, find the VCs that can help fill that and do your references on them.
These are great points. I think for seasoned entrepreneurs, they're probably a little bit more commonsensical, but if you raise money for your first company, right, what the points are really simple but very important. Like you might say, well, my first investor is I know Brad. That's not enough. You need to know these 3 people up here plus all their friends to make sure that it's a right fit for your company. And it's easy said but harder done, but it's so important, and you have more resources than you think you do. Literally your first investor, you should ask them who else do they syndicate with, who else do they talk about. So these are just great points. I'm going to switch gears just a little bit in the same vein. So we're in Indianapolis, and I travel the globe for Lilly, and there's only San Francisco and Boston in the biotech world, but that's not true, right? There are literally thousands of companies around the planet, both on the technology side. You name the industry, Southwest Airlines, you name any single company that have needs for technology and growing. And I think a lot of people say, oh my gosh, I'm not on the coast, I'm not here, not there. And I think that's not true, actually. We see literally dozens, hundreds, if not thousands of companies, both in the US and globally, get funded outside the big innovation centers. And I know that my friends to my left deal with a lot of things outside of these epicenters for innovation, right? Do you have any words of advice for entrepreneurs in cities outside of that in terms of ways to cut through it, make fundraising more efficient, make their company more well-known. I'll start in the middle just to mix things up a little bit. And so maybe any advice to our friends out here on the entrepreneur side that aren't necessarily in Boston?
Yeah, I guess one of the silver linings that came out of COVID is Zoom and being able to speak with people that are not sort of in your immediate vicinity. And that just made it very easy for us to meet companies that are not only in Boston, but sort of all across the globe. That's piece number one. And the second thing is that really great technology can come from anywhere. And we've really seen that. We've made investments all across the US, Europe. It just, if the science is awesome, you will get found.
Yeah, agreed. Max, any perspective here?
Yeah, I mean, maybe just to echo what Annie said, I think it's probably the best time in the history of the biotech ecosystem to be raising capital outside of the major hubs of Boston and San Francisco. It is so much more the norm now to take virtual meetings. It's not that we don't care where you're based, but we were interested in where you're based, but it doesn't really, it's not a deal breaker. It doesn't factor into decision making as to whether we want to make an investment or not. And I do think that the sort of normalization of virtual meetings, especially early on in the diligence process, really facilitates that. I think one piece of advice on how to get in touch with coastal VC firms, if that's your target investor, is cold reach outs are okay. Warm intros are helpful, but even if you're just reaching out cold over LinkedIn or over email, Andy, I'm curious if you read those. I read those. I still try to respond to all of those messages. And the one thing I'll say about that is if it's a cold reach out, I'm generally having to make a decision within 60 seconds or so. And so to the extent that you can make the value proposition super clear, don't bury it at the bottom of 5 paragraphs, but what is the patient need that you're addressing uniquely? To the extent that you can lead with that, I think it's really helpful for drawing investors in and getting them to respond and set up time to learn more.
Great point. I may add one more thing too. We're talking a lot about the capital formation, but I think also COVID has taught us that you can run management teams virtually.
Absolutely.
Right? So if you think you don't have the human capital element too, you're probably wrong, actually. You can pretty much run a company out of anywhere.
Yep.
So I wouldn't put that as a hindrance either, but back to the original question. Kendra, do you have a perspective on this?
Yeah, I think in addition, you've got investors and innovators that are moving all over the country. Like people have moved to different places. So I definitely agree. You can do things virtually, run teams virtually, meet your investors virtually. I think it's really important to also meet in person whenever you can, and more than likely there's some sort of tech innovation something in a region near you. Maybe not everywhere, but there are. So seek those out, find people, network. We after COVID was over, we told our younger investors, get out and meet people. Like that's where the relationships are built. That's how you know that these are the people that you want to have in your company. So it's nice. I think, like many things, the world is hybrid now, and so I think that being able to do it online is a really great start, and also being able to do it in person helps facilitate and accelerate things, particularly if you're having trouble getting movement online, which can sometimes be the case.
Yeah, I think generally this is the best time on the planet for innovation, and it's so fluid. Capital is fluid, people are fluid. It's just a fantastic time. One last comment on the entrepreneur side. So, besides getting your innovation or your company off the ground and running, the second most exciting thing is an exit, both for our venture friends and for the company itself. Any tips or advice on preparing your company for that moment or that time, or even getting close to that event? Any perspectives there from our venture capitalists? This does make venture capitalists very happy, by the way, just to put a little explanation.
Put smiles on our faces.
Put smiles on everyone, even the entrepreneur's face.
Yeah.
Max, we're going to start with you. We'll go down.
Sure. I mean, the words that I heard over and over again at Goldman when I was there, advised a lot of biotech companies is great companies aren't sold, they're bought. And so you can't really go into the process with the objective of exiting. I think that there are, sort of on the margins actions that you can take to make sure that there's nothing hindering your ability to exit, but that really the most credible alternative to an exit, in those negotiations is that you're going to sort of go forward yourself and continue to advance a program. I will say in terms of the specifics of what drives an exit, I do think that the bar has risen a bit over the last few years. I think previously many pharmas and public investors were willing to take a risk on early preclinical programs without clinical proof of concept. And so driving to clinical POC didn't have to be a core thesis for an investor. I think that's changed quite a bit today just based on pharma and public investor interest. And so in our Series A's, just to be specific, we are always making sure the company has enough capital to get to clinical POC, because otherwise it feels like there's, at least right now, still a bit of a valley of death where if you're not there, the route to exit or even value inflection for a subsequent raise is a little more dicey.
Annie, I'll go in reverse order. I keep mixing it up on these guys.
No, I totally agree with what Max said, and maybe in addition to that, just practically speaking, start those conversations early. Like if you feel like you want to know what pharma is thinking, it's sometimes feels opaque, but talking to them as soon as possible and just starting to get a sense of what is the product that ultimately would be most attractive to pharma or whoever your buyer is. I think that's paramount. And in addition to that, also talk to your board, because they oftentimes sit on a ton of boards. So they have purview not only of your company, but also multiple other ones. So they have a better sense, or could have a better sense, of what is sort of the exitable product, if you will.
Right, Kendra?
Yeah, and I would say we probably have a slightly different lens because we're not investing in on the bio side. We're investing more in health tech-enabled services, the picks and shovels, as we were talking about in one of the calls. And I think, being really mindful that you're solving not just kind of the problem at hand, but how extensible is that beyond that. There's a lot of point solutions in the health tech space right now, and I'm hearing a lot from providers about the fatigue and the difficulty of managing all of those. So being mindful of that, how are you solving an existing problem today, particularly if it's in a non-patient facing way. That's where the big, kind of, slogs are that people are really tired and are really causing challenges. Or, can you bring a drug to market faster with some of the processes and technologies? So thinking about the problems that you're solving and how that really can extend and grow from there is important. The other thing we touched on earlier is we think a lot about capital efficiency. So if you have a very high capital stack, meaning you've taken in hundreds of millions of dollars and you're at 10 million in revenue, that suggests that maybe you're not that capital efficient, and you need to tell us a little bit more about why you've used so much capital. Pivoted? No problem. Explain to us how that's changed and what you've learned and what's been done from there. And then I think the final learning is I was at a startup before I came to Touchdown, and we had a huge valuation. I thought, this is awesome. Well, guess what? That's not always the case. So don't be so focused on the valuation or the amount of capital raised. Focus on being as capital efficient as possible so that you can get to an exit and make everybody money, including yourselves.
Great answers. I remember hearing the future still matters. Your past is nice, but for investors, it's always, what is that future and that roadmap? Well, I've got like 7 or 8 minutes left, and we thought we had to do AI. We wouldn't be a panel if we didn't talk about AI. There's probably some car drivers down there talking about AI and how it impacts, race cars. But so let me get to the panel. My jokes are terrible. They're free, just to be clear. What's your view on the convergence of AI and healthcare? Now, I would just say someone take it first, but I'm going to go to Kendra just to make it, because she couldn't wait to answer this one. So, Kendra, do you have a perspective on that?
I mean, I think it's table stakes. You have to have, look, every company has AI in their name now, so it doesn't help your valuation, just to be clear. But it really is table stakes. I think a lot of what's being called AI may not actually be AI is a big question. I also think that it's AI in service to what? There's so much data in particular in healthcare, and we're just starting to see some of the unlock happening with data, and that's happening from a variety of things like architecture and processing and analytics, and how corporations are actually interpreting that and changing the way they're running their businesses. So AI can be very helpful there. And then we have a physician on our team, and I asked him specifically how is AI helping him in his job, and he said all the non-patient facing tools are really helpful. The documentation, the prior authorization, those are game changers for them. So, so those types of things are really solving problems, which are huge, but I think we're in the early innings for sure.
Yeah, and I guess echoing what Kendra said, it still feels like we're scratching the surface of AI, machine learning, and healthcare. One thing, I spend a ton of time looking at companies in the early drug discovery phase, and there I think AI is still sort of yet to be realized in terms of what it could give us. And I think that's the part that I'm most excited about, in terms of being able to pick new targets to go after, new chemical matter, and sort of make the process of finding your drug development processes faster. So I think that's all to be seen still.
Yeah, I mean, I think in our portfolio, almost all of our therapeutics companies are using AI in some way in their discovery process. Certainly all the small molecule companies are using AI in their drug design process. And so it does feel like in therapeutics like a little bit of table stakes as well. And we've seen a number of new companies being formed around an AI platform, and that they're using really differentiated AI, and so they're going to come up with really differentiated drugs. I think our thesis, and welcome to sort of have a discussion about this and be proven wrong, but our thesis is that that's kind of a tough value proposition. A lot of these algorithms are borderline commodities, and unless you sort of have large-scale proprietary data sets that can be leveraged in a differentiated way, it's really hard to see the path to long-term competitive differentiation with solely an AI-based platform. It certainly can and perhaps should be a component of how drug discovery is thought of today, but as sort of the sole differentiator, we're a little bit less bullish, I guess, on that.
I can tell you how not to use AI. I posted a position for my team. I called it Analytics and AI, and my team thought we were firing half the team. And I said, well, I know how not to use AI, okay? So I just wanted someone to teach me how to use ChatGPT. But it's clearly going to affect all industries and everything we do. This is a serious, I actually did do this, by the way, and it's not going to fire anybody, I can promise you. But let's end the discussion, if it's okay, with, I love crystal ball stuff, so let's talk about the future. I got topics from value-based care to care and delivery models. Give us your crystal ball for the next, I don't know, 2, 3, 4, 5 years. And you get a volunteer for this one. Who wants to take this one first? Talk about their crystal ball. How's the future going to look?
Because
all right, Max, I'll get to you.
Yeah, I mean, I think that there's a lot of enthusiasm today for what we're calling larger indications, more common indications. There's a lot of unmet need, and I think that a lot of that is driven by the remarkable success that Lilly and Novo have had in the metabolic field, the very exciting late-stage clinical data from Lilly and others in neurodegeneration, and it's really, I think, reminding the entire industry that if you want, if you're looking for a mega blockbuster commercial product, that in most cases is going to come from these large indications. So there's a lot of investor interest and pharma interest in these, I think, indications that have been a little bit, not forgotten, but just less in vogue over the last 5 to 10 years. But it does, I think it makes me think a little bit about, why those indications weren't in vogue for the last 5 to 10 years. And a lot of it is that these are challenging fields. These are complicated diseases that are multifactorial. The clinical trials are large and expensive and prone to late-stage failure, and so a lot of folks got burned in these fields, and I suspect that will happen again, and hopefully we'll get a lot of really exciting innovations, like tirzepatide over in this cycle. But my guess is that in 5+ years, folks will be a little bit, I think, scarred from pursuing these large indications and late-stage failures again, and there will probably be sort of a resumption of interest in rare disease, more targeted therapies, targeted oncology, these types of indications that are lower biology risk, lower clinical risk. And so that's my guess of where things will be. Maybe not in 2 to 3 years, but 5, 6, 7.
Down the road. Annie, we'll go to you. Your crystal ball.
Yeah, I think where perhaps we might see an opening, and I hope that we do, is kind of what Max said regarding the challenging indications. There's still a ton of unmet need in, for example, cardiology and in kidney diseases, where folks are sort of recycling drugs that they've used in other indications to those indications. So I really am hoping that there's going to be sort of a breakthrough in the biology so that we actually can finally get drugs to these patients.
And last but not least.
So I think there's a couple of themes. I'll just quickly touch on them. One is just the metabolic health that we're obviously seeing with some of the GLP-1s. I think that as we're moving into this next phase, I'll be really curious to see how the multimodal approach changes. So as you wrap around food or other kinds of care delivery, in addition to the drugs themselves. I even was having a conversation with someone earlier today, like, is this a tipping point where we actually start to move towards value-based care because we get a baseline of metabolic health that then we can wrap things around that help us think about more preventative instead of reactive. So potentially that would be an amazing outcome, I think. And then more broadly, building on that, I think the care delivery kind of the care pathways. I think we're really seeing a shift there. Primary care, obviously, a lot of the younger generation doesn't have, primary care physicians. A lot of that care is being taken care of by nurse practitioners and physician assistants. And so, as more and more physicians shift into specialties, how that changes, it's going to. We believe it's going to be more hybrid as opposed to just going to a brick and mortar doctor's office. I think that the different types of care will have nuances. Certainly, acute versus chronic is going to have a different type of approach. But I think that we're in the early innings on some of the hybrid and different care pathways. Somewhat tied to different health issues, but just broadly speaking. And I think that the industry at large is really trying to figure out how to solve for that.
Great. Well, I think we're out of time. I want to thank the audience and my panelists for the discussion. Really appreciate it. Unfortunately, the moderator doesn't get the crystal ball because we'd be here for 2 hours and I'd pontificate up here. So anyway, everyone, thank you very much. Hope you guys have a great conference, and thanks to my panelists.